While we're seeing a slight decrease in COVID-19 cases right now, it is the increase in deaths that is rather alarming to doctors, and it really has them scrambling to try and help their patients avoid ending up in the hospital on oxygen or in the ICU. In tonight's Health News to Use, we look at the newest treatment that's helping patients fend off the worst of COVID-19.
Health News to Use, sponsored by Tulsa ER Hospital.
How are you feeling?
A positive COVID test is a frightening diagnosis.
Let me take a quick listen to you, okay?
Only here at Tulsa ER and Hospital, there is new hope with a new treatment, monoclonal antibodies.
So basically, instead of waiting on your body to form its own antibodies to start fighting the COVID infection, which may take a week or 2 weeks, we actually have IV and antibody infusion to COVID, can start fighting the COVID infection much quicker. All right, so you got an infusion till a little after 2 then.
Dr. Mark Blubaugh says it's for high-risk patients, 65 and older with diabetes, kidney disease, a compromised immune system, or for 55 and older patients with chronic underlying heart or lung problems.
I think as of today, we've infused over 130 patients, and we've only had one return that had to be hospitalized. So that's pretty good odds.
When a patient fits the criteria, doctors discuss the antibody option, recently given emergency authorization for use by the FDA.
This doesn't give you immunity, it's not a vaccine, but it may help jumpstart your treatment of the COVID infection and prevent you from getting worse and prevent you from having to be hospitalized.
It's a 1-hour infusion, and patients are watched closely for any adverse reactions. Doctors here haven't seen any.
We've actually heard back from a bunch of patients that actually they felt great the next day.
Dr. Blubaugh is convinced antibody treatment will soon be used for other illnesses.
Antibody infusion is something that I believe will probably take off in the future, not just for COVID. I believe they'll kind of run with this and develop antibodies to other illnesses that we can start treatment early on as well.
Now, Dr. Blubaugh really wanted to emphasize that this treatment does not make you immune from the virus. We all still need to wear a mask, wash your hands, keep your distance, all the things that we do to fend off COVID. And while you're waiting for the vaccine, which he recommends, he also says do the normal things that you do to stay healthy. You know, stay active, work out, eat a healthy diet, take your multivitamins, don't smoke or drink too much, and just try to stay healthy.